is part of the adult services team, which Bob Dalton and I have been a part of for, gosh, some half a year or better now. And I thought maybe we'd brush up a little bit on what that entails, mostly because that's kind of a nice crossover between folks that are either homeless or having difficulty staying in homes, with the idea being, whoops, we okay now?
Yeah.
I was getting feedback. The adult services team works with trying to get people not only into services, but actual housing, food stamps, things like that. Bob and I have had no small success with a couple of folks, so we can talk about that next time too. Anyway, I'm feeling rather good about it. Both the connection between mental health, Lynn County Mental Health, and the city, and then through Billy Cannon, the Lynn County Mental Health and the school district, and maybe get some discussions going, clarify what's been going on, frankly, I think just get our act together, both sides. So I think that's that part of it. I have other stuff that doesn't necessarily have to do with that.
So follow up, the next meeting after we talked at the school district, they presented that program to the school district, so it's moving forward.
Good.
And part of the conversation that we had was this piece that she does on suicide prevention, and that they would be providing that training for their staff, but eventually for the community. Has she expounded on that at all?
Hello.
Dick, did she revisit that conversation? Okay.
Yeah. So that's part of the rest of a report. If you don't mind, I'll just keep going. If you don't mind.
Okay. No, that's perfect.
So for the folks in the room who may not be aware of it, the program that Lisa's talking about is something they call QPR. It's called Question, Persuade, and Refer. And the idea is to help train adults in dealing with kids who appear to be suicidal, may actually be suicidal, and to become comfortable with dealing with folks who are falling into that kind of trap. They've offered Albany, well, actually, this training comes out of what they call prevention, which is a combination of addiction services and mental health. They've been offering it for a while. Pre-COVID, much of it was, well, almost all of it was geared toward coming out of Albany. They just began to switch to include Lebanon and Sweet Home. And then of course, COVID hit, and that limited everybody. They're now reopening the large, one of the large rooms at the Addiction Services building in Albany, and they're doing both QPR and mental health first aid, both adult and children, although less so. The QPR people also grabbed Billy Cannon, and made her a trainer, which puts a trainer for this suicide prevention right in the middle of Sweet Home. And what both Jim and Lisa were talking about was that Billy is trying to figure out how to offer the class in the community. She emailed me also asking a similar question, but it was probably on the same day that they had the board meeting, wondering how to best go forward with that, because, and I know this is true, that they tried to do it earlier coming out of Albany. They were going to try to come here, and they had no interest. Nobody signed up. I think they had one person. Again, these things happen, but what I suggested to Billy is maybe if they market it a little bit differently and emphasize the whole pandemic thing, this whole angst that everyone's going through, that kids might more particularly be feeling at this time, we might be able to get more people involved. Not to mention it's also going to be taught by someone who comes from the community. You know, the folks in Albany are more than willing to help her. She's already had conversations with, she's very good about making contacts with people who have been trying to make inroads into Sweet Home. So any encouragement from you, Lisa, and or Jim would be deeply appreciated, but they are going in that direction.
So I think Dick, I think the big thing that was positive for me coming out of it is that they're going ahead with the program for all the staff to learn this.
Right.
And if all the staff learns it, then that will create more excitement in the community, because I think more people will know about it and maybe more people will come forward.
Yeah.
So I'm hoping.
Yeah, and to add to that, once you get a full house or a really good class, the folks from Albany can also feel okay about kicking in, and they could do a separate one. You'd have 2 a month if you needed, because we don't want to drive Billy out of town by overworking her.
You know, the other thing that my daughter had went through was a DPT class, and I know it's a lot the same functions as what you're talking about there. That it just goes into a little deeper than that. But a lot of those programs that are self correcting or self beneficial that people don't really know about yet. I think some of those things we need to get out in the public where they actually understand what they do, because if it's self-correcting, self-help, people, oh, I don't need any help. I don't need that, but they really do.
Yeah.
Chief Len.
And Billy's pretty good at that. Like I say, it's probably more about how we market this, how we sell it to the community.
Exactly.
They're out there. We can do this.
Dick, real quick, my thought on marketing into the community is if it can be in different, if there can be a classroom portion, but also even record that so it's an online portion, because there's a lot of people are not going to come to a meeting or sitting down in a seminar, but they may do it online.
I'm finding that very beneficial for some things. I also find that if you're having an event where you're wanting people to physically come in, that when you provide food, whether it's a grab and go or a pizza or something like that, you're going to get more people to attend. Yeah. It's just the way it is.
Yeah, the difficulty with that, much like mental health first aid, these are very formal classes, and there are books that are handed out, there are tests that are done internally, that sort of stuff. So how you do that together, or you know, that way, often a teacher can be part of basically the virtual training, but the people, it helps to have them in the room for many reasons, but from the psychological side, that tends to work better. And they're finding that more and more as folks are using the virtual method. It works if you're just feeling bad and having a bad day or whatever, but if you're getting close to being suicidal.
I'm referring to training itself as far as the...
I know. And you really need some special training about that. You can't just talk to a pretty picture like I am. So
So,
I'll bring that up. We'll talk about it.
So I think one of the other things we talked about, Dick, was doing it like at the, in the gymnasiums and stuff where you had plenty of room.
or the
Right.
high school cafeteria.
Cafeteria or whatever.
So, and there is another program that we could kind of emulate an outreach to the community if we're looking at different topics over time or different facets of the same direction. They have something called parent cafes. We could do something called community cafes, and where you bring in the community and they sign up and participate that way. Because you're wanting people to sign up for this, and we have limited seating no matter what we do right now. And you want it to be more intimate, but with social distancing. So you're probably looking at 20 people at a time, probably.
Yeah, I
makes
think
sense.
the room in Albany at the addiction service is really very large. It's about the same size you guys are in, maybe a little bit more, but they're limiting them a dozen, 18, I think max. I think it's a dozen. People are being pretty careful about this, and rightfully so. So, yeah. And yeah, I've heard of the cafe before. I've not taken any time to look into it, but it's another option.
Yeah. Well, I was just thinking marketing and
Yeah,
getting
I also-
people in that door.
I also wanted to bring up the fact that there's a youth mental health first aid class being offered November 17th, and this will be in Lebanon. It's actually the First Baptist Church. And I was realizing as I was going through this is the kind of thing that I would be more than willing to email to folks, not just Lisa, but everybody in the group.
Mhm.
But I don't actually have email contact lists. So maybe Lisa and Julie, maybe we could figure out some way to have like a contact list, and I could just, when I get them from the other groups that I do, I could forward them to you. So people could stay ahead of it, and even Jeff. You know, there are areas that the police department might be interested in. You know, I'd be more than willing to do that.
Dick, who's putting that on?
But well,
Who's putting on that particular class that you just mentioned?
Yeah, the mental health first aid is all done through, it's kind of a combination of addiction services and mental health. It comes out of prevention services. And it's actually, their link is actually prevention.
Lynn County.
The reason I asked that, you're saying it's being offered in Lebanon. Would they consider doing something like that if it was offered in Sweet Home, I guess is my question, and if there was enough interest?
Well, they have done that, both adult and youth. Mostly adult mental health has been here, or mental health first aid was here for, they did one for the school bus drivers, did one for 3 or 4 other places, I think even senior services. But the whole COVID thing kind of, you know, messed everything up. But they're, like I say, they're just now beginning to feel comfortable coming out. They've got it down to where they know a certain number of people can be in the room, that sort of thing. So they just did a mental health one, I think in Mill City. That was last week. You don't have to live in those areas to go. It just makes it easier to get there.
Right.
So I have a question to Chief Lynn. So we have Sean Morgan that works on outreach. Does he maintain some kind of a web page or something with the police department to where Dick, some of these flyers he sends me might be something that could be posted where somebody could download them if they had a centralized location in the city to go to? Would that fall under something that would benefit him in his tasks?
Yeah, I think it's a couple points there. I think we could, if we have those flyers, we could easily get them out through either Sean or Legia with the city. Now it's just a matter of we figure out where the best place is, where most people will access them, whether it's through our social media accounts or on the website or linking one to the other. So definitely doable, and I think it's something we should look more into. And even when Dick mentioned earlier on about, and I think you did as well, about bringing in all the services that are already here that people just don't know about. And we've talked about it many a times that there are a lot of services, many more than I thought were in our local area, especially when you start looking for them. And but I think the majority of our community still is not aware of that. And how do we get that out there? I don't know those. I don't know.
It's just almost like you have to have a reader board out on the public highway that blinks it up in front of the faces all the time, because I know Dick's put so much time in that, way more than I have, identifying resources. And it's like you said, where you fall through the cracks is it's there, but getting people to know it's there and access it is the hurdle. You can have 50 services available, but until they're in a crisis mode, will they pick up the phone and say, man, I need some help, I got to find a service, Beyond that, it's almost like a billboard, you got to post it out there.
First time I was at Samaritan today with Lisa, and I'm sitting there looking at their reader, their TV, and it actually has mental health services and starts giving the numbers of places to get a hold of. And that's the first time I've seen that from Samaritan out there, because it has other services other than Samaritan on it.
Yeah, and that is a first. They've had some major administrative changes, and the people at the top are finally realizing that they're not the only game in town. There are reasons for that, but that's another discussion.
It's almost like you need those same 3 monitors at all of our pharmacies in Sweet Home while people are standing in line waiting for their prescription.
Well,
It's rolling right
it's
past
true.
their eyeball.
There you go.
It's true. I mean, when I looked at it today, I thought, well, that's a start. That's a lot of them, but there's a lot more that aren't on there, but still, it was a good start.
But having that suggestion to them, it's an aha, well, why didn't we think of that?
Maybe as the community health committee, I'd make a motion that the chair send a letter to the pharmacies and ask them to put up those maybe on a reader board.
It's not a bad thought, like, as you're sitting there thinking about where do you look at those? Will people stand in line and wait for
Do we have a second?
second?
We have a motion on the floor. Any discussion?
I'm not counting a quorum.
Okay.
I didn't even know talk to them a minute.
Yeah, I can.
You got
do
a motion on the floor.
We have a motion on the floor. All in favor?
Aye.
Any opposed? Motion passes.
If I could, I would back up to Jeff's earlier comment. The prevention people, the ones that do the mental health first aid, they have a Facebook page. Other Facebook pages are out there, and that's not a bad notion. There's a way we can link the Facebook pages. Jeff's Facebook page could refer back to something offered somewhere else, etc. I don't personally know how to do that, but we just had a long discussion with another group who is really trying hard to do that, because it turns out kids who really need this stuff are reading that and looking at that. Well, they don't even use Facebook anymore. They've got their own thing going, but we could link into those kinds of things. So I like that idea. I'll try to lock into some folks.
Well, now that you got me thinking on this, you have how many churches in town?
Yeah.
And they could put that up on their website also for mental health services. There's no reason that.
Just services in general, it's just,
Yeah.
It's a shame.
I mean, just have the different services there. So if somebody pulls up their website, they can see that too.
Well, they have a group that is organized to have discussions, and I think, so you don't have to go individually to each one.
You don't really have that anymore.
They did here for a while. They were meeting.
Ministerial group.
One Sweet Home.
Yeah.
That is still.
Is that still going on? Because I heard it wasn't. There wasn't.
Well, they might be a good one to approach. That way you don't have to approach them individually.
Mhm.
But I thought about this and I think we're aware that people are in crises now that haven't ever been in crises before, but they've never accessed services before. They don't know how. They are worried about being stigmatized. They have that big of a problem with having their children stigmatized through school. So to be able to access services easier. So that, because I remember the superintendent had said something about these students committing suicide because they don't have a prom. I think, but what they do before they had proms, you have an underlying mental health issue that's being magnified, and prom becomes the focus point, or the, senior sports become the focus point. But there's an issue to start with that was just, has escalated. And so, because people don't commit suicide because they can't go to the prom. There's something else going on.
I must tell you, people are beginning to do research about this, and it turns out now you've always got the extremes. These things are on a continuum, but many kids are actually preferring this method because they're at home, they're studying with mom and dad, they're actually getting family life together, which they never had before. But when you're in trouble, you're in trouble.
Yeah.
I have one more thing, if I might.
Sure.
And I could actually forward this too. There's going to be free COVID testing in Albany on the 24th of October. It's at the South Albany High School parking lot. My guess is it's from 10 until 2. My guess is from midnight until midnight the next day there'll be a line. I'm just being silly there, but it will be there. And then on that would be Saturday. On the 25th, they're doing it in Corvallis at the Linus Pauling Middle School parking lot. They're aiming more towards folks who are struggling, but not necessarily. And they're giving away some freebies, actually, first couple hundred people that are there. But I've got the names from some of you guys. I'll forward this, and then we can decide what to do with it. I kind of expected it to be in the Democrat Herald, but I have not seen it. So.
Yeah, because I think that's something they'd be interested in. Even the New Arrow would be interested in, I would think.
Yeah, maybe. Yeah, this is just my understanding is it's just a drive up. You drive your car in. They don't. I don't think they poke you in the nose even. It's a self-administered test. No need to get out of your car. It's a pretty good deal.
Okay.
So
cool.
I'll email folks.
Thank you.
I can just see you, Jim, sitting in your car running a 10-inch tube down your nose.
Yeah. That doesn't hurt a bit.
Just keeping a straight face while you do it.
Thank you, Dick. We really appreciate that. That was a lot of information. And I know that we'd had that conversation with the superintendent some time ago about needing to have some kind of conversation with our kids, even at the grade school level, about internal dialogue, framing, and having the vocabulary and the insight. Because we teach them about physical health and we teach them about geography and math and stuff, but they're walking around with these brains and a culture. And if we can do an intervention geared towards appropriate mental health and cultural, social, all of those things that go with this, we could actually change a lot of the outcome for our kids in this community. Their attitudes about relationships and their attitudes about going on to school all start when they're little, and we can make a big difference. So, and that comes to play with the needs of our community as adults. And so I think we'll move on. Bob.
Okay, just to kind of feed off of some of what Dick was talking about. I've been trading emails back and forth with Tricia Shug, the business development for Samaritan in regards to mental health, a town hall workshop scenario, that small version of that 20 to whatever number we could do. Maybe a targeted audience. I told her, maybe a 60-minute program, maybe a 90-minute, whatever that is. I just kind of threw it out, and the idea of, getting some guest speakers in from the mental health side to talk about topics around mental health and dealing with stressful times in our communities, and really targeted at the probably the community a little bit more than necessarily the school group. She put me in contact with Heidi May, who's the director of Samaritan Mental Health Program, and I received email from Heidi. They moved that up in their priority of things to do, to bring some sort of a program like a mental health 101 type workshop setting to our community. And their first person they talked to, and Dick knows this person, is Dr. McCarley, who was actually part of the with the mental health portion of the mobile van when it came here, but they talked to him and he said he would be excited about doing such a program, coming in and talking to an audience about mental health and that. Heidi is reaching out to a second entity. I don't know who that is yet, so we're just kind of trading back and forth. And then, and I've talked to Dick that once we get a little bit more feedback, then maybe we could formulate who's the audience, what's the length of time, what are the topics we want them to kind of target on, or at least let them tell us what it is they'd like to, and just have that conversation to get something going. So I think that's very promising. It's just working with that group is like, as Dick said, with COVID, the resources and the timeline is just scattered out, and it's kind of like herding cats. Sometimes you wait for weeks and you bump them and then they go, oh, I remember you got a hold of me. So that kind of, you have to keep pushing it. But I'm excited about that they are wanting to do that in our community. So I got that one. And back to Dick earlier, talked about the adult services team. I do have a call in to Deb Powell, and I'm waiting back for that to see where they're at with their group of coming back into the Sweet Home area to offer those types of services. But again, back to the COVID is what disrupted the apple cart on that happening. So I need to find out how they're doing. Are they doing it? Do they look at some targeted dates or some times to return? So got a bunch going. So
we can look to some community partners. So I contacted Velma with Oregon School Employees Association, and she said that if we wanted to kick out some pizza or something like that, that they would pick up the tab for it. We also have the popcorn popper, to where we could do like little giveaways of kettle corn or something for people who show up, or, to help stimulate, because Dick had just said giveaways and things like that, and to stimulate some interest, engagement, happy feelings about being there.
Popcorn popper, that's our kettle corn machine.
So, but we can do that ahead and do some things like that, or we can look out to some other partners like the Elks or the VFW to help with some meals or something, maybe.
And the format, like I'm kind of perceiving, would be that you could have an auditorium where people are really social distanced out.
Mm-hmm.
A guest speaker comes in and talks, and then maybe opens it up for people to interact and ask questions back, and not just be on the receiving end all the time, because, to get them engaged is what gets them open up to start talking. And then again, who's the audience? Is it a specific group of business people you invite, or leaders in the community?
One time the next.
Maybe one time one the other.
But when people engage like that, they have a more harmonious outcome. They feel like they've got more to come out way with for the average person. So.
And back to Dick's point, educating the public, to me, if you've got some of your employers in there that know these resources that we were talking about, and that earlier, people start learning what the resources are, to me, they can go back to employees and say, by the way. So I think it's a twofold process here, but I'm excited about it. I think it just been, so it's like pulling teeth. It's painful because you're wanting it to really take off and go and you're just waiting. So anyway,
Sounds
Dick
good.
knows what I'm talking about.
If I might, just to add to the discussion about the bus, we were reminded that the medical and mental health bus were supposed to be in town in October, but they're struggling with the rebuild of their engine. So it's looking like November.
They're still planning on coming back, but you're right, Dick. It's supposed to be here October 6th. Well, that's coming wet, so.
Yeah.
So when they had that out, did they have like sandwich signs or something out in the public, letting them know it's there on the reader boards or anything? Would that help?
Don and I, we've both been on foot delivering flyers through the community, and Dick, he's done the same thing. I just took the poster down at church. I had actually about a 4-foot poster I put up just really to get people's eyes. And again, it's like the bus comes and says, they put out a little sandwich board, but it's getting people to step through that door. I mean, the info's right here. Here it is. It's there for the taking, but unless you hang the carrot to get them to come through the door, it's just like, don't really have an issue until I really have an issue, I guess. I don't know. It's frustrating because I think the first time, even with the medical side of it, a few people went through the door, and the next time a few less, and then none. And then the day that we brought this Dr. McCarley in, no one came, even though we talked about this service being available. We talked about changing locations, move it down in front of the school, down at one end or something where it's more visible, move it to the Safeway parking lot or something, but.
What about out here on the side in front of this little grass area that belongs to the city? It'd be on Main Street, out here, and there's plenty of parking for it to be off to the side.
So Dick, is it because some people don't want to be seen going in there?
I don't think so. I think we had a reasonably good first attempt, but it was because we went in, it was right next to where food was being served. People were sitting down, having their dinner, get up, and then you might want to go see a doctor about your sore foot or whatever. And as soon as the COVID thing happened, now you're in trouble because they just want to get in, grab their bag and leave.
Yeah.
So what I'm trying to do is get the folks at Samaritan to take a deep breath and give us at least 2 more chances. I always say 3, but it'll probably be 2, and try it again. Quite honestly, some of this lays back on the fact that, and I'm going to have to be careful with my words here. It's not clear. Well, now I'm sounding like Jim. It's not clear which audience we're actually going to be serving, because the emphasis we were trying to get to the folks who are on the streets, didn't have money to pay for service, whatever. Samaritan is a healthcare industry, or part of a healthcare industry, and they have rules and regulations that says they have to be available to everybody. You can't just zero in on the 12 people living behind Safeway or whatever. And they know that's odd, and we know that's ridiculous, but we have to be able to figure out how they can feel like they're servicing the entire community, as well as meeting our needs of trying to help folks who really are. And this is where it gets kind of hard for me to talk about, because if you don't treat those people who are living on the streets, they're going to end up in your emergency room, and they're going to cost you a bundle, because they can't afford to pay for it, and you're going to eat it. But it's because they went for 3 or 4 years with a sore foot, and they didn't have to do that. So they're very aware of it. It's just how you do that. One of our thoughts was to zero in on the time when kids need vaccinations, and we just let the bus know that they need to bring in a bunch of vaccines, and they can help give vaccinations to the kids at the school. Same way with sports physicals. That actually almost panned out. So if people are needing a sports physical, it's not very fancy. You just need somebody who's got a license to do it. You put them on the bus and, you run 10, 12 jocks through and it's all done. But again, it's how you get that information out there. And unfortunately, we only had 4 or 5 attempts, and then the pandemic thing happened. So we keep blaming a virus that nobody can see.
Yeah, thank you. Your turn.
Well, we got 3 more banners that I just got yesterday, 2 more yesterday and 1 more coming. So I think we'll be up over 85 by the end of this year. And we'll have them all, well, you can see how far they go out now. They're out to the Harley Davidson shop. So we figured we needed about another 8 more to go into Foster, 10, and then another 10 more after that to go out to the Point. So if we end up with by next year when we open up again, if we have another 5 to 10 more, and then another 5 to 10 more during that deal, we'll be pretty close to the Point from end to end of town. Just for everybody's knowledge, I've been touting this throughout Lynn County, and we got Albany on board now, and they've got 50 people that have signed up for banners in Albany, Oregon now, and they're going to try and get them up before Memorial Day or before Veterans Day, and then Lebanon now has got one that they're talking about doing there, and the discussions are already going on between the city manager and the downtown association and the others that are going to do it. I'm going to the Rotary in about what am I scheduled? Probably 2 more weeks, Jeff, something like that. And I'm going to promote it there because the Rotary in Albany is the one that's took that over, and to see if the Rotary here in town would take that as one of their projects to because everything's up and running. It's not that you're doing a bunch of stuff now. It's just an ongoing project, which is good for our community partners, and the Rotary's looking always likes to have things that run smooth. So hopefully we can do that.
And I think they can bring some assets too,
They can bring a lot of assets that.
mission statements and things like that. So.
And just to one more thing that's not about the banner, but I am really excited about where we're going. We had that's our third meeting when you and Bob showed up with the school district, and we're going down the right path, I think. And we're they've promoted that out in the school now, in the community. And I think we're going to have, if we can get 300 plus people in the school district trained up with that program, it should create excitement for some of the other folks in the community to probably take it also, because they'll be talking about it. And once you start talking about it, then other people might get excited about doing it, parents or students.
So Jim, just real quickly, I got to tell you, actually 2 of the other meetings that I go to, Sweet Home came up. I don't think anyone remembered your name, but they gave a lot of credit for the banner project. Both Albany and Lebanon, they're doing it. Each one is doing it slightly different, but each one gave credit to Sweet Home. It's kind of nice to do.
Yeah. Well, we don't need credit for anything. We just need to have them done. That's all it is.
Well, you
I'm
did
excited.
good. You did good.
So,
You know, we get a lot of flack, but there's a lot of good things that come out of this town. So a lot of really good things. So, Chief Lynn.
Nothing new really on my front. My community service officer was out for a couple of weeks, so it's kind of a little setback. Still working extremely hard. A lot of the other regional partners on addressing some of our weaknesses with our homeless response. And that's actually something, and I know Bob's been involved in that quite a bit. It sounds encouraging. There's a lot of things like you talked about that are kind of sitting out there that hopefully can come together and maybe make a significant impact on. Do you have anything to add to that, Bob?
No, I think, like I said, for myself personally, it's just, I've got to keep my finger on that pulse and just keep pushing on it. You know, I think that's the only way we're going to get some people to come back into the community. And I know from my experience over the years of just working with some of these outside resources, it's like a reintroduction for them to come into our community, because I know years past they, you know, they've got that hesitation to come back into Sweet Home, because honestly, I don't think they felt real welcome to come into Sweet Home, and now we're kind of restarting this whole process over. And I think it's a good process. It just takes some time to keep chipping away at it, and we're doing that little by little, and it'll gain momentum. And I think, as we've said before, the more we can get our public leaders up to speed on some of these that's out there. I mean, I went back just 2 days ago, and I went back as far as I could dig to look on, you know, what Sweet Home said it would do. And I was looking back through the archives and the charters and the studies that have been done, and they all kind of are almost a repeat of a repeat of a repeat of saying the same thing. The community is asking for this. They're asking for a health service. They're asking for this. And, you know, I think that's what I feel is the importance of this committee. It's taken us a while to figure our direction. I think we're still learning, but, and I think it's going to be up to us to help educate the city council and get their support and let them look back in their charter where they talk about what their goals are around services, and health being one of them. And I think this committee can be that link to help drive that. I guess what I would like to know going forward is, you know, now that the city council has kind of set some of those types of goals, or the city manager, as to what is it do they really want, and to utilize this group to achieve that. And I think, and looking maybe for another couple key players to join this committee that brings some diversity into it and some experience that, you know, we may not necessarily have, but I think it's good. I think we've hit on a lot of topics over our meetings, and trying to get drilled down to specifics sometimes eludes us, you know. It's like, who's going to do it and when are they going to do it? And those are still obstacles that we will probably face, I'm sure, going forward. We're waiting for someone else to do it, and we find out, oh, we're supposed to be doing it. So
I think that's on the addressing the homelessness. That's one of the big
yeah,
obstacles, is who's going to help drive it, who's going to drive that bus. And we don't have, like, if you look at the road retreat, some of those areas down there, they have that entity set up that is pushing all of this. And we don't.
But the deal is if it's, you know, if some things aren't taken care of, then you deal with it. You're
going to deal with it regardless.
You know what I'm saying? I mean, if
You end up with it, yeah.
If it doesn't, if you don't work on some of these other issues, then you got to deal with it over here on this issue at a much more difficult thing over here.
The point I go back to with Bob is that who is going to be that entity that puts this all together? Who's going to be the entity that develops, builds, and operates some form of transitional housing aspect? You know, who's going to
No, I understand that. I do.
That's I think the biggest challenge right now is that we don't have anything set up. There's a lot of discussions, but there's nothing.
But you know, I've seen things come out of this committee in one meeting. You know, one meeting we set up the community health committee. really. You know, one meeting, we had that done. One meeting, we got a sharps container.
Yeah, I mean,
You know, I mean, there's some things
we chipped
that
away
we
at.
chipped away at. It's not always perfect, but at least we're going forward and getting some things done. And I think you're right, Bob. We have to continually chip away at it and continually move forward, because if not, nobody else is going to do it. We got to be that person,
The driver.
the driver. We got to continually do that, continually
I
go
mean,
forward.
Dick and I were off tomorrow to a meeting and around housing, small housing project that's in Albany. We're just he's introducing me to someone over there so we can talk about what they're doing. That's sort of a program. So it's reaching out there and, you know, and asking, what are you doing that we might be able to replicate? Back to your point, I just had this discussion the other day with a person from the city about affordable housing. We build houses, but we're getting in a time in our country where housing is not going to be accessible to a lot of people that are on a fixed income or low incomes. And to me, you could barely see that population that's living on the street or out of a bus or a motorhome growing. I mean, my son sees it in Portland with leaps and bounds, and I just saw Portland report out on housing. They're sold out. Portland has no inventory. And so, okay, where does a person get?
Well,
It's an issue.
when you talk
Have to be
about
addressed.
that, Blue River, for instance, a lot of their housing is gone up there. Where are those people going to go? You know, and if they do go somewhere, there's no housing down in Eugene or Springfield. So, you know, if those people transition to another close town, there's no housing.
They're living in hotels and campers and stuff is what
Yeah.
they're doing.
Look at all the people down south in Phoenix and Talon.
80% of the population was burnt out.
Get a contractor now.
There was 3,000,
You can't,
You have to wait on FEMA to clean it up because of the household
there
chemicals.
was
and
3,000
asbestos.
houses down there that are gone. I've got pictures of it. It looks like a bomb went off.
Yeah.
So, but right here, today, I think we're making huge headway.
Yes.
Making big headway. So my to-do list says, email list to Dick, a letter to Safeway Pharmacy,
Safeway, Thriftway, Bimart,
Probably Walmart.
Walmart, Samaritan Health.
okay. And then an email letter out to the people who would normally attend our community health providers, possibly even survey them for things that they would like to see coming out of this committee, or and invite them to each talk about the services that they provide to this, okay, or to our community. And but those are the big three. Am I missing anything?
Well, you could do similar to what Rotary does, is you could call each individual entity and just ask them to put on a presentation at each meeting.
I think that's what we're gonna, I think that's how we're gonna have to go with, you know, because otherwise they give a snippet and that's just the surface of what people are doing. And so if we're like a communication hubs, that's how I see this, of information where people can come together and work or know the resources that are available and move our community forward. We need them at the table. We also need to know what they're bringing and what their entities have to offer so that we can work together.
What do you think, Dick?
Well, that was the idea of bringing mental health in next month. And
Yes.
Just try to find those entities and invite them in.
Yeah.
I can think of a couple of others. It's kind of like Jeff's point. Mental health has been in this community for a long time. It's just where and how often, and people just don't know. But they're here.
Mhm.
Okay. Is there any other business?
Motion to adjourn.
Second.
By just because there's no more business, we're gonna adjourn. Thank you. We'll make the formal motion. Motion to adjourn is not debatable. It has been seconded. All in favor?
Aye.
All opposed? Okay, thank you.
Thank you. Okay.